Today I'm going to talk about the dental instruments we as dentists use to come up with a diagnosis when you come to our office in pain. Now, the first thing we do is, of course, your history, the pain history. It is important to know exactly about the pain, where it's coming from, when did it start, how long it lasts. After a thorough history is taken, then of course we use a common instrument that is used at every office, the mouth mirror and an explorer. Now the explorer is quite sharp. It helps us find the suspicious area or the cavities that are causing an issue. So all we do is run along the tooth with our little instruments, and if we feel a stick or the instrument goes in, then we know that there's a problem going on with the tooth. Now, mouth mirror is just used to retract your cheek and your tongue so that it doesn't get in the way. Now, if you come to the office with gum problems, or even if the tooth is hurting and it may be coming from the gums, we use something called as a perioprobe. Everybody has experienced this instrument, especially when you go for your cleanings. We do a perio charting, which is the gum reading to see what kind of cleaning is required. Sometimes we use it in diagnosing a painful tooth just to make sure the pain's not coming from the gum. It is just placed in between the tooth and the gum, and the measurements are taken. Just goes like that. And that's how the gum reading is done. Okay, we take digital x-rays. This is the sensor. Of course, we cover this. This is placed in the mouth, and we take an x-ray of the tooth that's bothering you. Once the sensor is placed in the mouth, this is the x-ray that is placed closer to the sensor. We click an x-ray and we get the picture of your tooth right away. Another kind of x-ray that we use is the Penrex. It's the one that goes around your head. It shows us all your teeth. This also can be used as a CT scan. It shows us the soft tissues as well as the bone levels. We also use a cold test that's placed on your tooth. This is called endo ice. All we do is take a Q-tip, spray. This is the ice. We place it on the tooth and we see how your tooth reacts to it. Another test is the air test, or even the water test. This is called as a tooth sleuth. All we ask our patient is to bite down on it and then open all of a sudden. And we place this on different areas of the tooth to find the crack. So this is called a tooth sleuth, and it's very helpful in finding a crack on your tooth. The articulating paper. We put it on an articulating holder. We make sure you bite down on it. And if it's high on your filling, we go ahead and reduce the height of the filling, and you start to feel better. Just wanted to show you what's included in diagnosing your teeth.